Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Yes, Mon General's committed physicians and Kay Murray and Jim Stallings should be committed radio hosts on Health Talk, brought to you by Mon General on WHAR. Good morning, Kay.
That's been said, Jim. You're absolutely right.
All right. Now, today we want to welcome to the show from Cardinal Pediatrics, associated with Mon General Hospital, nurse practitioner Pinar Nalchakan. Golly, I practiced. Honestly, I've spent the last 3 minutes practicing, but I just didn't do it out loud.
That's all right.
So I have to do
So
that.
it's a Nalchakan.
Nalchakan. Yeah, it's got that silent H in there that's just not there, so kind of fools you.
We'll add it in.
Yeah, that's all right.
Nalchakan.
There you go.
Yeah, that's always a good joke. We're on with that. Totally okay with that.
That's how I'll remember it, but I'll still screw it up a couple of more times before 9 o'clock rolls
That's
around.
the easy way.
Let's start off talking about, and again, we could talk about pediatrics, but let's talk about vaccinations. And one of the items in the news over the last couple of months, even in West Virginia, I think it was Pendleton County, that whooping cough has resurfaced again, and it is among those that have been vaccinated. So how is this happening? If you're vaccinated against pertussis or whooping cough, how are you getting it?
Well, there's a lot of factors that we have to think about, but really we have to make sure that we're up to date. We may have been vaccinated when we were 5 years old, and that's why the school system's really trying to get all the older kids vaccinated, and I think that's where our source is. They need that booster shot to really kind of be up to date. And then really we're kind of saying, getting the parents and even grandparents, because they're pretty large providers too, involved in a lot of the care with kids, especially with those young kids. So, we just need to get those boosters done and make sure that everyone's following up with it. I know we don't like to be told to get vaccinations, but really it's really necessary because kids are so much in contact with each other. And then we have to worry about the little babes that, they're the ones that are actually getting this pertussis. And luckily we haven't had anyone really truly hospitalized, not very many. But, it's still concerns and respiratory issues that can come about with it.
How is it contracted?
Coughing, with
So it's an
mucus.
airborne.
Yeah, and with the mucus, hand, things like that. Especially young kids are putting everything in their mouths, and kids they're sharing drinks and things like that.
Does it get a smarter virus? Does it mutate and learn how to fight the vaccine?
I don't think that's been necessarily, nothing like that's been out there. But we probably I'm sure with all this vaccine, nationwide, 13,000 positive cases that are actually reported. Just think how many aren't truly, followed up with or caught or even tested. Probably that's going to be something in the news, I would think, soon that they're going to look into. Maybe, so making sure this vaccination is actually up to date if they have to, change some things around.
Yeah, maybe I missed Jim's first question, but is this new that they have to have this booster?
I think school-wise, they've just recently said, 7th and 12th graders need to have been vaccinated within, this time frame.
Did we see numbers go up for some reason?
The pertussis, actually, yeah, and especially nationwide. Yeah, West Virginia, I think, and just like a couple years ago, there was maybe less than 100, and 2 years ago, there was between 100 and 200 that were actually reported, and then last year, the numbers I don't think have been out yet.
Yeah, has your office, or do you know if there's been any talk about a lot of students that have not been vaccinated or getting this booster?
Well, they're coming into the office. The 11-year-olds are typically what we're hitting up with, 11 and 12-year-olds, and those are the 7th graders. And they are coming in for their well-child visits, and we're getting those vaccinations, we're getting those boosters done. Really, the county doesn't allow, you have to have the vaccinations done. There's really very small circumstances that they will allow you not to. So, and they're pretty much non-existent. It's pretty much, we're two states out of the country that actually doesn't have any kind of, restrictions that you just have to be vaccinated.
I was told this morning that there are about 100 students at MHS alone who have not gotten their vaccinations or verified them with the school. And I think the cutoff date is August 30th. Otherwise, they can't go back to school.
And that's right. That's probably true. So at Cardinal, we have lots of times available. Even we can just give us a call. Cheat Lake is actually open till 8 o'clock. So just come on in. We'll get your well childs done. Make sure your kiddos don't have any other issues that we're not addressing. That's important too. Make sure we're growing right. Our weights are okay. Things like that. Follow up with our health issues, and then go and get your vaccinations done. Really, there's older kids tolerate vaccinations very well. No fever, minimal achiness maybe in the arm, but they just need to get them done. And it's truly, once they get it, we give them the slip and they're good to go to school.
Jim, you and I have talked about this on our talk show, and you wonder, is this because of people just procrastinating, or is this because of the belief of some individuals of holistic that you should not have these boosters? So I don't know which one, or maybe it's a little bit of both.
It probably is, because the first day of school, 200 at MHS hadn't got their vaccinations, and what that was 1 week ago today. So 100 since last Thursday, and as of today, it's still at 100, and that's just one school.
Yeah, and I'm sure it's more procrastination and just not aware, and like, oh, the parents are kind of like, oh no, we waited, I'll get to it all summer, and then here we are, school started. So it's probably more procrastination. We really haven't seen much hesitation among parents. I mean, I can't even think of anyone off my head specifically. Everyone's pretty open to it that have been coming into the office.
Yeah, and maybe that those that have not just are not aware
right.
that they must have them. And I'm sure now with going back to school, these questions are being asked.
Exactly.
Where are you located, Cardinal Pediatrics? I think you have 2 locations.
Yeah, we have one at the Suncrest Town Center. So we all know the new Suncrest Town Center. We're actually right in behind. So where the Five Guys and things like that. If you go right behind there, you'll see a great big sign, Cardinal Pediatrics. We're on the 2nd floor there. And then we have one in Cheat Lake. The one at Suncrest is open till 5, 8 to 5. And then the Cheat Lake office is actually open till 8. We take walk-ins. We try to schedule well child visits, so we make sure we have enough time to spend with patients. Well childs, we'd like to catch up and make sure everything, we give a good look down and make sure everything's going well. So we like to have those schedules if we can, but we are pretty flexible. We try to make sure we get our patients in.
I drive by the Cheat Lake office often. I think I saw you out there playing on the playground equipment or mowing the grass or something.
Again, yes.
Got to keep busy somehow.
What does a nurse practitioner do in a pediatrics office?
Actually, I'm a pediatric nurse practitioner, so I specifically have gone to school to work with kids, anyone up to 21 years of age. And basically, we work right alongside the physicians. We're primary care providers. There's really no minimal limitations to what we can do. And the good thing is we have our physicians there. So, we always have we're always open to getting a second opinion. Likewise, physicians like to come consult with us. It's a great working environment. And I think with nurse practitioners, we're fortunate because we get to have extended periods of time for well child visits. Physicians are they need to have every 15 minutes need to be scheduled, if not, more sooner. Nurse practitioners, we actually get 30 minutes for a well child visit, so we have lots of extra time to talk with it. And, we kind of have a more holistic view on things, so we like to try to hit from head to toe, along with, anything else that we can think of. So we bring involved family, we just have that time. And if you, especially young moms, breastfeeding, things like that with infants, we have so much time that we can offer that I think that's a plus with us, that, the other nurse practitioner and myself, we just have lots of extra time that we can allot for families and patients.
And I think people appreciate that, the timeline, not feeling like you're rushed, being able to ask the questions you need to ask.
Sure, yeah. I mean, I just try to make myself available. I try to help with phone triages so parents can actually talk to me and not just, a nurse or a medical assistant. They actually have me personally. So then if I'm like, let's just come in, we'll talk just face to face, no problem. We can fit them in right away. So
I did read something in the paper the other day about a nurse practitioner that's trying to go, I think she's going to go before the legislature in giving you more powers and wanting to write prescriptions, which you cannot do at this point, right?
There's the controlled substances. We have a little bit of limitation there.
Are you aware of that fight, or?
I know they're always in legislation. There's a big group of nurse, within the nursing realm that are really always in, trying to get in legislation and get us a little bit more flexibility, because, a lot of states, and West Virginia is a little bit behind in that, they're still fighting for a lot of things. Other states, they have full reign, and it's just every state has their own their politics and legislature.
But you can practice on your own. You could go outside of Cardinal and open your own business, your own medical facility.
Correct. Yeah, and by law we have to be affiliated. We have to have somewhat a physician there, a consulting physician if we need it by law. So there's always a physician behind us. But yeah, absolutely, we could practice on our own. And that's what we do at Cardinal too.
Pinar Nalchakon.
Nalchakon.
Nalchakon. From Cardinal
Your son's
Pediatrics.
If
cooler.
he starts singing in a minute.
And if we had Dr. Melanie Casey in here with you, would Kay and I have to talk at all, or could we?
Probably not.
Yeah.
Well, that's what we like. We like to hear you talk.
We're going to take a break and be right back. You're listening to Health Talk on WHAR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Nurse practitioner Pinar Nalchikhan is our guest from Cardinal Pediatrics.
Woohoo!
Back to you, Kay.
Well, thank you, Jim, because I think it is good timing that we talk about children going back to school, of course, and that could include some flu shots. Have they
Yes.
started flu shots yet?
Some providers have started them. We're probably go a little bit more gung ho within the next month or so. But yeah, absolutely, it's time. Now is the time. Flu season typically hits around December to February. We like to kind of get those vaccinations on board and get the body some build up to it. So anytime now we have it, it's ready to go. And the way it is, sometimes they run out of it. So I rather get it done and get it over with and make sure you got it.
Do we know the string that will be here this time?
They always predict. It's always a
Yeah.
prediction, and there's lots of science behind it. So we can only hope. Last year was really mild. We minimally saw it in the office. So
We didn't have a
good.
winter last year.
Yeah, so
if that had
that's
anything
true.
to do
yeah,
with it.
right. But sometimes we need a winter. That cold weather really gets rid of all those bad bugs out there. So that's good. We need that cold winter. I hope we
Yes.
have a cold winter. But so. Flu shot, flu. There's actually a mist too. So kids that aren't asthmatics, we can do the flu mist. So if we don't like the poke, because it hurts, things like that, we could do the mist, and it's just as well.
The strain's probably coming from China. It always comes from China,
Sure.
right? Little kids are little germ carriers
Yes.
walking around all over the place. What about even before elementary school? Kids going to daycare, kindergarten, those types of things. I don't know if you have to have a vaccinated child to get into daycare because they're pretty much privately run businesses, right?
You actually do.
Oh, really?
Yeah, there are actually some things like there's a hepatitis A vaccination that's recommended after, typically most daycares require that. And then if you're in school, it's the elementary kids, it's just recommended. So there's that. But for younger kids, the flu shots, after they're 6 months of age, they're ready to get it. And that first time they do receive that flu shot, they actually need 2. They get 1, and then a month later they come back and just get another to get that extra boost for that first shot. And then after that, it's once yearly.
Side effects of any type?
No, sometimes you can have flu-like symptoms, but that's pretty rare, and that's kind of like a farce out there. That's truly not what
You're not
happened.
going to convince people of that.
I
How
know.
many times I've heard, I got a flu shot and I got the flu.
Yeah, no, it's probably just your body is just kind of working on the vaccination. Really, it's probably psychological. I think sometimes too.
If we get the one for the children and for adults, really, is that all we need for the entire winter?
For that season, for that flu season, yep, that is. And ideally, if they got the strand correct, you should have a pretty good immunity to it.
What age are we talking about here? We're saying school age, but should it be younger?
6 months. If I have a
6 months.
6 months, they can get it. Yeah. So if I have my 6-monther coming in for its little well child check, I'm adding that onto their little vaccination schedule. So yeah, absolutely. And the other thing we have to watch out for besides flu is that RSV. Some people don't know what it is. It's basically a cold in the adult population, or even the older kids. Anybody really above 2 or 3, it's a cold. Lots of drainage, things like that. But the younger kids we worry about. Because they can actually wheeze from it and have some respiratory distress. So we actually saw a pretty good bit of it last year. So those young kids, along with the flu, it's kind of coincide. You got to do that good hand washing. When you're out and about, I like to use those wipes that you get at the carts, at the grocery store and things like that, because you just don't know. People just don't wash their hands. Even though we were doing the cough into the elbow thing and all that good business, it still doesn't happen. I mean, we're all guilty of it, unfortunately, just out of habits.
Who develops the vaccine schedule? Is that the CDC?
Well, we actually abide by whatever's American Academy of Pediatric recommends. So that's what we practice in our office.
Has that pretty much stayed steady?
Yeah, that's standard. That's nationwide.
Or that they don't tweak it or anything? Because there is some concern that it's too close together, a lot of these.
American Academy of Pediatrics recommends this certain schedule. There is different schedules out there, Dr. Sears, all these different schedules. Ultimately, American Academy of Pediatrics is what is recommended. In hindsight, I think if we just need to get our kids vaccinated, that's what it is. If we vaccinate the herd, then we don't have to worry about, that's the theory behind it. We just got to get the herd vaccinated. So if you have that one that's not vaccinated, we're not getting everyone else sick. One person isn't vaccinated, then 10 people aren't vaccinated. Those 10 people are getting that. that whatever we're trying to vaccinate from, and then we're having issues, and then we're seeing these things come out again.
One of the controversial ingredients, thimerosal, some have said there's a connection with autism there. Are they still using thimerosal?
Don't say that. That's not right. There is no connection.
Well, I'm saying some say that.
It's a bad study, terrible study that was done on a population that wasn't appropriate. The population wasn't a general population. It was a terrible study and has really left a bad taste in a lot of parents' mouth. And, ignorance is bliss. What you don't know, you believe anything that's out there because, you want to trust the media and you want to trust these scientific studies. But it was a terrible study and it's really unfortunate. It got a bad rap for, vaccinations, but it's really just not true.
But we want to know here in the United States why, well, it was 1 in 150 a couple years ago. Now it's 1 in 125, maybe even lower among boys. We want to know why so many kids are becoming autistic.
We do too. And I think there's just, all the science and all the money that's been put into it. It just needs to keep doing it because there's got to be a reason. Is it environmental? I don't think it's the vaccinations. Really they're preservative free anymore. And, you just can't blame vaccinations for it. Yeah, that's the one thing that might be the easy way to think about it, but there's something out there. And, you have to think that we're now more aware of what autism is. So, there's a large spectrum of autism. There's really high functioning, there's low functioning, there's so much in there.
The spectrum disorder is what they talk about.
Right. So, are we saying, this kiddo could be fully functional, really maybe a little bit, he needs a little help in school, but other than that, he's okay, maybe a little bit of social, but we're giving him that and he's getting into that number. So, and then we are 120 some per,
Well, I know one mom who believes that her son changed after he got his vaccinations, but you work with children pre-vaccination and post-vaccination.
Right.
Have you ever seen that, a change in a child?
I personally haven't, but, and I can't even say any of the physicians have even, we've even talked about it in the office. To be honest, in my opinion, you can't be a perfect, developmentally appropriate, doing everything you need to be doing, and then the next day you wake up, you're not. I just don't see that happening. Every well child visit, that's why it's so important to get these well childs, especially these younger kiddos, the babies, just as we recommend it, because we ask specific questions. We look at these babies, we're looking for developmental appropriateness. We're looking for any delay. And if we see that, we jump on top of that. There's lots of programs out there that can help with that. And so we're following up with it. But, I just don't see a kiddo perfect. And then the next day, he's just not.
Do you think they're born autistic?
I think there's some chemical issues there in the brain that has to be there. I just don't think it
something
can
that's not going to be picked up during the pregnancy with so many times you can now.
Right. Yeah. Whether they'll pick it up in pregnancy, I think that might be hard. There's all those ADHD things out there. Those are all chemical imbalances in the brain. So I don't think that would be picked up in utero. But I think from the beginning they've had to have some kind of delay. Whether they didn't crawl on time, they didn't walk, they were really delayed to walk. They're nonverbal. Eye contact, pointing, all these small things that we take for granted that babies do. Pointing is a big issue, is important, that a baby is pointing and looking at you. And even though they might not be talking, that pointing is a communication. And, crawling and walking, we look at these milestones. And if they're not hitting those milestones, then we follow up real closely and make sure that they are. So there's got to be some underlying issues there. We just don't wake up one day and say, we're autistic.
Pinar Nalchikhan is a nurse practitioner with Cardinal Pediatrics. You're listening to Health Talk. We'll be back in just a moment on WHAR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Jim Stallings along with Kay Murray, and our guest, Kay, is?
Oh, listen to you. Pinar Nalchikhan?
Sure. Yeah, woohoo, good.
Thank you. And Pinar, I want to get the relationship between Cardinal Pediatrics and Mon General Hospital.
Yeah. So Cardinal actually covers all pediatrics. So from the nursery, from newborns, all the way up to any kind of pediatric patient that would be admitted to Mon General. So in the daily we round up there. We're taking care of those newborns, making sure they're doing okay, following up with them. They come over to Cardinal, we follow up with them. And then if you have an asthmatic or someone that's just really ill, they're having some pneumonia, things like that, that's submitted, we follow up with them too. So any pediatric patient, we're right there with them.
All right. Now, if we want to get a vaccination schedule,
yes,
we're one of the 100 kids whose parents haven't done anything about it. How do we get a hold of Cardinal Pediatrics? How do we get an appointment to get this done? Can we get it done before the 30th?
Absolutely. I mean, you could just come in that day. Truly, we always make time for our patients. And in Cheat Lake especially, some people hesitate. They think it's like this faraway land. It's really not. It's like, 6-point-something miles, I think, from the other office. So give us a call, 599-8000. There's someone, that's going to answer that phone, get you in that day probably. I mean, most likely 99% 99.9% of the time we're getting you in. We have a walk-in clinic. We don't like to, like I said, we don't like to do those well childs as a walk-in because, we just like to spend all that time.
All right. Well, thank you so much for coming in today.
Thanks, guys.
You've been listening to Health Talk, brought to you by Mon General. Morgantown AM coming up on WHAR.